It's a campaign to push the Nigerian government to give more priority to the health sector, and nothing conveys their message and mission better than their banners. Nigeria has one of the most problematic public health sectors on the continent. Public health sector workers spend more time going on strike than working. Most public hospitals, though affordable and free in most cases, are mere consulting clinics. Maternal and under-5 mortality rates are among the highest in the world. The country spends at least $1 billion annually on medical tourism, especially to India. It's all these horrible statistics and more that these youths are calling attention to and hoping to get the government to increase the health budget from the current 4.6% to somewhere around 15% in the next budget cycle. The march would eventually terminate here at the National Stadium in Lagos, where members were given postcards to send messages to their representatives in Parliament, urging them to take action on the country's public health sector.
We have an online campaign, and we are trying to mobilize 1 million Nigerians to speak up for the health sector. And that is the first one. The second one is that we're mobilizing 100,000 citizens of Nigeria to write to their own representatives. And so we produce postcards that individuals will write a specific message to their own representatives in Parliament, and then they can send, we will deliver this message directly to these representatives. The whole message is that they should put health on top of the agenda, that it becomes the priority of this administration.
We want the government to invest more in the health system. We want to see improvements when we go to the hospital, to have that confidence that when we are sick, we will not be afraid that we will die of diseases that are simple, that are preventable, or that are treatable. We want to have that confidence that not only when we travel abroad that we can be able to access good medical care.
And perhaps to further demonstrate their commitment to their cause, the group organized this open free screening for HIV, malaria and hepatitis for people to know their status.
What is your name?
My name is Deji Badmos. I decided to take the HIV test to know what my status is. My blood sample is taken for analysis. And while we wait for the result, I get some counseling.
By stick to one partner or faithful to one partner.
Minutes later, my result is ready. All right, I have just done my test now, and of course the result is out. I did the HIV test, and I've just been told that I tested negative. And guess what? I've been giving some condoms, and of course, well, this is a booklet on HIV. I mean, this is a very wonderful initiative organized by this group, and there's no question at all that it's just the way to go. It's the way to go. Now, whether the organization is able to get the government to increase the health budget of this country over the next 2-3 years, we just have to wait and see, because this country, of course, is contending with other issues other than health. Deji Badmos, CCTV, Lagos, Nigeria.